Brilliant. I'm just going to get Rachel in. So what I'd like you to do, do you remember at the beginning of the day I was talking about how important it is that, here he is, how these days are all about all of us together and what we can offer, not just about sitting back and saying, what are you guys all doing then? So in that spirit, and to kind of keep the feedback as interesting as possible, if we could hear your biggest and best idea, just the one thing that you think was the best one, okay? Okay, one thing that you're doing, one action you're going to take, and then if we could spend the time with you telling us what you need from the rest of us, so that then you guys can be saying, right, that's something I think I could be part of, and we'll do that really quite practically, and you can say, we'll have hands up, and then people you can get in touch with. Is that all right? Now, is Neil around and Catherine from, yes? No, I know you didn't do that bit. So do you want to do a bit, because your session was slightly different? Yeah. Is there some key messages from your session that you'd like to do, particularly for this afternoon's one? Okay, hold a second, let me get your... I need to get your... Can you pass it up? Oh, hang on, thank you. Okay.
Hi, so this afternoon session, what we were doing was looking at the power of metaphors when we tell stories. So we're looking at all the unhelpful metaphors that exist currently for social care. So things like tsunami and burden and ticking time bomb, everything that talks about social care as a crisis or a burden. And then we generated some new metaphors to tell the story of social care that we want to tell. And those will then, we will select some of them to then test with the public. So you can see both in terms of what Pen is drawing on the board. These are some of the many metaphors that were generated by the group, who were absolutely brilliant at it, I have to say. And then on the paper, the 3 lists stuck on the wall are all of the ones that came up with people's ticks against them. So the ones that received the most ticks were the metaphors that people felt were the strongest and the most effective at telling a new story of social care.
Brilliant. Are there a couple just of nice ones that you could pick out?
So,
for example,
It's Like Yeast is one over here that got quite a few ticks. There was one around a spider's web of support. Any others that anyone would like to pick out? Oh, the thermostat. Oh yeah, the thermostat.
Thermostat, okay. Cool.
Okay,
fantastic. Anybody who's interested in kind of thinking around the metaphor, thinking about the reframing, who's the best person to get in touch with?
Sorry. Eating carrot cake as we're talking. So we are going to be taking this project forward now, and it's crucial to us that we involve you all the way through it. We're not trying to do this in some dark room, but the next stage for us, and we're going to be working with Equally Hours on this project, is to take a proper deep dive into how the public talk, think and feel about these issues. So we're going to start that research, and within that we will explore some of these ideas and see whether they make sense to people, whether they actually work and move people in the direction that we might want them to. When we've done that, we want to convene again with people and share the results of that and sort of think through what the implications are before we go to the final phase of this research, which is about persuasion. So we know how people think and feel, we know the story we want to get across, we've thought about how to express it. Let's really work out now how we tell this story in a way that causes the public or a segment of the public to genuinely come behind our ideas and our way of thinking. And then we've got the tools to work with to start communicating on that basis.
Thank you. Fantastic. Okay, so this morning's sessions, Martin Walker. I saw you come in, there you are. So what I've asked people to do, Martin, is just say, of all the ideas, what do you think was the biggest one, the biggest one, and then what was one action that you need to take, and then let's really focus on what other people can offer.
Okay, so
the other mic go. There we go. Thanks.
I guess we spent quite a bit of the session. People were pretty frustrated, and we had to get through and past that. So one of the things I learned was, certainly for TLAP, that talking about a Care Act rhetoric-reality gap, it's more of a chasm. I think that was a real takeaway message.
One big idea then.
Trust. How do we build trust across the system, across different stakeholders, all the different people that we need on board to get a better approach to self-directed support? We need to build trust, and we need to go away and think about that. We've got some ideas that we presented to the session. We didn't really get into the depth that we perhaps could have done because we needed to get out the frustrations with the system.
Brilliant. So, in terms of what we need from other people,
so
other people in this room and people who they know.
One of the things we put to the room was there actually are a whole set of networks that get together and think about and work on self-directed support, and we're all kind of coming up with the same frustrations. So how do we bring that together better and take that to people like ADAS and the department, say, actually, we need to change this. Here's some crystal clear ideas how we could do that.
Okay. So again, if people are interested, are you a good person to get in touch with? Anybody thinking this is something I would be part of? Yes.
One of the things we're going to do as soon as we possibly can is put a newsletter out.
Okay.
Which will say, this is what people are working on, this is who you need to talk to about it, here's how to get in touch with them.
Brilliant. Fantastic. Okay. So be thinking. So I guess that's the job for today, is to be thinking about, when we get that, what might I be up for? Fantastic. Thanks, Martin. Sarah, do you want to? Of course. 100%. Absolutely. No, 100%. I just want to make sure I don't miss anybody. That's the only thing. Sian, Susie, here we go. No, Sian's not here.
So we were doing the Making Communities Mainstream bit, where we were looking at kind of community-led and community-level support that is not kind of formal social care, but it's about that kind of safety net and how we can move from where it is now to that being really well resourced and adequately valued. What was I doing? One big idea. One big idea is that this is about much more than social care. This is about communities. So if we're talking about local authorities, it's not just the social care department. We're looking at neighbourhoods departments. We're talking about economic planning, business rates, all sorts of other things. So how do we get more than social care into the room for those conversations, which I think is the kind of action for us. The other thing that came out as an idea was JFDI, which is just do it. Which I think it was a good way to look at it in terms of just cracking on and trying stuff. Things for us is to go and think about how we can bring in more people to the conversation without it feeling like it's getting co-opted into big local authority systems and the kind of good creativity getting lost by bureaucracy. And what we need from other people are examples of great community-led and level stuff so that we can really start to build the evidence that this stuff is there and it's having a bigger impact than just the individual things on their own, but also for people to talk to their networks about this stuff so we can try and start to build a bit of a kind of movement, something around it. Sian from Community Catalyst and us from Power to Change are thinking about how we can take this forward, kind of aligned to Social Care Future. I think kind of through the newsletter and things we'll work out how to get people more engaged with that. But if you do have any kind of immediate thoughts, come and find me or get my email address from someone, drop us a line.
Brilliant. So if you think that's your thing, be prepared. Fantastic. So we'll come back to you. Martin, do you want to?
So if we're trying to make the social care vision come true, we're going to need to change how public service resources get used alongside those of people and communities and citizens and businesses and others. So we're going to need to change what we currently call commissioning. So our session was about that. The biggest idea is we are going to find and work with 6 places in the country to really have a serious go at making that change happen. What we're working on and we're going to build on further is the best that we know about how to do it so that we can help those people really effectively. And what we need from everybody here is once we've got our start of a 10, at the minute we're about start of a 3 or 4, we'll share that around with everybody and we'll ask people for their ideas and their insights and their examples. And also help us find the 6 places. that are worthwhile and up for it.
Up for it, yeah, brilliant. Okay, fantastic. So that's something, if you know that where you're from is somewhere who would definitely be up for it, and you've got evidence, then getting in touch even before the newsletter will be a good thing to do. Fantastic. Brilliant. Alex? Seamless.
Thank you. So we were the asset-based area group, and we were thinking about how can you get everyone in an area to change how they think and act to make the social care future vision real. So the people in power, the people in roles helping people, and the people who are looking for support. So we have a model that Think Local Act Personal developed called the asset-based area, which is 10 actions that an area could take to make more change. And we talked about the ways in which we'd all act differently. We talked quite a lot about behaviours. So how would people in power behave differently? And if they did, what would that allow workers to do differently? And what would that allow citizens to do differently? And I think our big idea, we talked about keeping the momentum from days like this going. So everybody talks about the fact this is energising, it's lots of people in the room together around a shared vision. That doesn't happen very often. How do we keep it going? So there was something about connecting, and people were committing to carry on connecting with each other. And then there was also something for Social Care Future to do, which was about lobbying the bodies that maybe aren't currently, that have some of that power and aren't currently on board. And we talked about the tipping point. Who do we need in that half of the scales to create that tipping point, as well as the people who are in this room and in this wider group? So can we get CQC to do things differently, the inspectors to ask for different things? What about NHS Digital, the organisation that does a lot of the measuring stuff and counting stuff? Could we get them to count and measure different things? What about Social Work England and the training, how people are trained at the beginning of their careers to think, and actually way beyond social care as well. So there was some challenges there for us as a collective to try and reach out to those groups, as well as some commitments for everybody to carry on connecting and sharing.
Brilliant, thank you very much. Are you ready?
But we had great fun sharing some of the focus of the people who were leading our workshop have been having in terms of connecting people and connecting communities. And we talked a lot about we're not an exclusive club, so people saying how can we get in touch with you, how can we share what we're doing. So we've made a real commitment to find a way of mapping all the great connecting and community-focused projects. But we thought we kept coming back to, there was one really important thing that we had to do and that we'd like you all to consider, and Ryan has agreed to sort of talk to you about that.
Yeah. Basically, what I come across is that we must, all of us, invest in the relationships we have with the people we work with, because it will gain mutual respect. It will get you feel warmth, you feel trust. And because that don't come straight away, that comes with earning and the speaking. And I think that's really a big thing, because it's one of them where they say, oh, it's a professional relationship, but it feels much more better if you talk to each other and it doesn't come out as professional, but as your friend, as someone who cares for you. And I think that way it's a lot better, because everyone then will feel, well, they're not looking at me professionally, they're not looking at me as, oh, well, I'm just one of the clients. It's nothing like that. It's more like, well, I've known this person for a long time, and we know what he's going through, and we know what we can support him with, and I reckon that within the relationship it'd be a lot better off, and everyone will feel more connected.
Fantastic, thank you. So something that resonates with the Be Human stuff that Julie was talking about in the open space, that makes a lot of sense about how we are with each other. Fantastic. Now, I don't think I've missed anybody out. Is that right? I'm always prepared to think that I might have done. Did you want to say anything before we play the photos? No. Yeah, brilliant. Yeah, no, thank you so much.